Something you might have heard a little bit about in the news today. Some men with prostate cancer in Leeds, they've been having ear acupuncture. It's to help with the side effects of their treatment. The NHS does offer limited sessions, but a group at the Phoenix Centre charity is for people who actually can't afford to continue doing that privately. Larry Budd has actually been to try this out.
How big is it?
The part we use is only 7 millimetres long.
Will it hurt?
I can see you're nervous, which is very, very common. And afterwards, people often just go, was that it?
Do you know exactly where you're going to put it?
I hope so. I've been doing it for 20 years, so yes.
And there's pins and needles in my heart.
At the Phoenix Health and Wellbeing Centre in central Leeds, 7 men are laughing and chatting over tea and biscuits. All of them have prostate cancer. Today they're here to have small needles stuck into their ears.
Acupuncture basically is putting very, very fine pins in particular points which have an effect on the body. My name's Giles Watts and I'm the acupuncturist. So when people have prostate cancer, one of the side effects of the medication is the female menopause because they're hormonal regulating products that they use. So they often get hot sweats and they can come on any time. And it can be really socially and physically demoralising. And we have a stack of evidence, actually, which is incredibly positive towards acupuncture reducing sweats.
And you've got a packet there of 10 tiny needles. They've got about an inch of orange handle on it, I suppose. That's the bit that you grip, and then a tiny needle on the end. So I'm ready when you are.
The classic for this is to actually feel as though you've been bitten by a tiny insect. So it should nip a little bit.
Okay, so, I mean, actually, that was the first one going in. That hurt more than I thought it was going to.
But not now. It's a little nip and then it goes.
Yeah, although it does sting. I thought it might hurt less, but maybe I've got a low pain threshold.
Potentially everyone's very different.
So the first and second one hurt quite a bit, and then the third one I barely felt.
Okay.
And by the fifth one, it just felt more like a tickle.
So are you stressed?
Possibly.
So it might be you're just carrying away a bit of stress and therefore those 2 points are more active.
My name's Gary and I'm from Morley, diagnosed 2016. Part of the treatment causes hot flushes. It feels sometimes like someone's turned a tap on and just soaked you, whereas acupuncture tends to calm them down.
My name's Chris from Tingley. I was diagnosed with cancer in 2011. I'm an engineer, I've got quite a scientific, logical mind. Before I started on the acupuncture, I thought, well, I'll measure what kind of difference it makes. So the week before I started the acupuncture, I counted the flushes. I was having about 20 a day. And after the very first acupuncture session, I didn't have any flushes at all for 2 days.
My name's Peter. I'm 80-year-old. I'm from Driglington. Not Bridlington, Driglington. I was diagnosed in 2014.
I get the impression that many of you are coming for, yes, the acupuncture, but the camaraderie, the experience, the banter, exactly.
Very, very important, you know. It is brilliant. I'm on a high now, and it'll last me till about Tuesday, Wednesday, and then I can't wait for Wednesday to come.
I'm listening to you lads.
You are.
Jill Trevor's with me, director here at Phoenix Health and Wellbeing Centre. It's been really interesting to meet these guys this morning who are all suffering a really serious disease, and some who won't survive it, I'm sure. But the joy that they have from just being here is almost as important as the treatment they're receiving.
They come along each week and they look forward to coming, and the treatment helps to alleviate the symptoms, but I think the shared experience is worth as much to them, if you like, and probably the tea and biscuits helps.